Here are the top 8 symptoms of bone-on-bone hip arthritis. Number 1 is stiffness in the front of the hip, right here, right where the leg, where your thigh meets the rest of your body, where if you were to pick up your knee and bend at your hip, in the bend, in the fold right there, that's where people tend to feel stiffness in the hip joint. And this stiffness comes on typically first thing in the morning when you first get up out of bed. And then another time that it comes on is if you've been sitting for a long time. The times can vary. For some people, it's as little as 30 minutes, but some people need to sit for an hour or two or more. When you get up after sitting or being still for a long time, the stiffness comes on then too. And the reason for the stiffness is because of the root muscle imbalance that's causing the bones to be smashed up on each other, said simply. It is compressing the joint, and when you're still for a long time, that compression just causes the cartilage inside the ball and socket joint to be smashed, which decreases the lubrication in the joint. So when you first begin to move, it's kind of sticky, it's kind of stuck, but then after you take several steps and it frees up and you begin to move better, that's why the stiffness happens. If you can fix the root problem, then you don't have stiffness. That's not a forever problem, by the way. It can get better. The second symptom is pain in the front of the hip. So in the exact same area, people get pain because sometimes you don't get a ton of stiffness or it's intermittent, it comes and goes, but you might get pain also that comes and goes, or it can be constant. Different people have different experiences, but there's these constellation of symptoms that you might get, and you might even get certain symptoms at one point in one flare up, for instance, and then maybe 6 months later maybe you feel better, and then you flare up again and you get kind of different symptoms. That can also happen. So pain in the front of the hip, right in the crease of where your leg meets your body, that's a common site of pain if you have hip osteoarthritis, especially if it's bone on bone. Number 3 is weakness in your hip. A sensation of when you're walking around or when you go to stand up out of a chair where you feel like you have to lean on your good side because it just doesn't feel as strong on your bad side. That sensation of not trusting your hip, that's usually a weakness feeling. Or if you lose your balance on one side more than the other, on your affected side, on your hurt side, that's usually a sign that you don't have good strength in your hip because you've gotten weak, and so you just tend to lose your balance more on that side. Number 4 is not being able to bear weight through that side. So same idea, you get some weakness in the muscles around your hip. Usually it's the glutes that are very weak, but if it's irritated inside the joint where the ball and socket joint is, then it may reach a level where standing on your feet, weight bearing, begins to become painful. For some people, it happens right away as soon as they stand up and bear weight, and they have trouble walking all the time. For others, it comes on gradually. They can walk around for a bit, 20 minutes, 30 minutes, some as little as 5 or 10 minutes, and then it begins to hurt. That's also a symptom. And the pain can be in the front of the hip. Sometimes people will say it feels deep in the joint too. On occasion, but it's rare, people will say it feels on the back. It's way more common to get pain with weight bearing in the front or deep inside the hip joint. Number 5 is noise coming out of your hip joint. Now this could be a grinding sensation whenever you pick up your knee or move your leg out or rotate it a certain way. It could also be a clicking sensation when you move it a certain way, or a pop that happens, like the joint popped loose. More often than not, the grind is associated with bone on bone hip arthritis. And the reason for the grind is because there's excessive compression inside the joints because of a muscle imbalance. And whenever you go to move your joint, there's friction, increased friction, more than there should be inside the joint, causing the noise. Now the click can happen if there's a damage to the surfaces of the cartilage, either on the socket side or the ball side, and when your joint moves a certain way, it passes over that damaged part. It can make a click, a repeatable click sound. And then a pop can happen whenever the joint is stuck. This most commonly happens if you're stiff because you were asleep or you were sitting for too long, and then you get up and your joint kind of makes a big loud pop sound, and then it usually feels a little bit better afterwards. Just think of like a jar of jelly or a jar of jam. You know, it's a really sugary substance inside, and if you close the lid and there's remnants of jelly on between the lid and the jar, it gets stuck. And when you finally pry it loose, it can make a pop sound because you unstick the lid from the jar and all the sugar that was keeping it stuck in between. That's kind of what happens in here when there's a lot of compression and you're squeezing the cartilage in there and you're laying still or you're sitting still for a long time, and then you finally get up to go move and it pops loose, and then you have some more freedom within the joint. You feel like you can move looser. That's kind of a lower level sign. So don't freak out if you get that already and you're thinking, oh man, do I have severe bone-on-bone arthritis? That's more of the common thing that happens to everyone whenever they have the imbalance happening, whether it's very mild or it can even be a severe situation of arthritis. It happens across the whole spectrum. The grinding is the worst, clicking is kind of in between, and popping kind of happens to everybody no matter at what level of arthritis you're at. Number 6 is a loss of motion. So this is obviously when it's a more severe case where your hip can't come up as high as the other side. On your other side, you might be able to get your knee all the way up to your chest when you're bringing your knee up. But on your affected side where you have hip arthritis, it may not want to come up as high. You may get some discomfort at the end of the motion, or it just feels blocked. No pain, you just feel like you don't have any motion left. Also going backwards and out to the side. So moving your leg back this way can be affected, or moving your leg outwards to the side can also be affected because all of these motions happen at the ball and socket joints. If you have an obvious limitation, it could be stretching can help this in the short term. If it doesn't help it, then chances are you have a more severe situation in your hip of arthritis. Now, stretching doesn't resolve the long term. You need to fix the muscle imbalance. But if you stretch a little bit and you do have an improvement in your motion, then that's a good sign that there's potential for you to heal your situation and maintain an increased amount of motion or reduce your loss of motion if you do the right treatment, which is going to be fixing the root imbalance. Hey, I want to interrupt the video really quick to tell you about our hip arthritis recovery program. This program has 3 major components in it that you can take advantage of. One is it's got a curriculum. It tells you exactly what to do to heal your hip arthritis, to go from not being able to walk, having pain in the mornings, stiffness in the mornings, fear that you're going to have a hip replacement eventually. It tells you all the steps in the curriculum, but then we've also got coaching. You get group coaching that's live with me and my recovery coaches, plus you get into a community of other people that are on the same journey as you, trying to avoid having a hip replacement and getting back to doing the things that they love to do. Learn more about this program, the Hip Arthritis Recovery Program, in the link below here in the description. Back to the video. Number 7 is when this hip problem is affecting your life. And I'm talking affecting your mood, which is going to mean it can impact your relationship. You know, if you're grumpy because your hip's hurting and now you're treating your family members, your loved ones, your friends, the people around you, your acquaintances, maybe even strangers, you're not nice to them, you're not your usual self around them, and you think it's because you've been having trouble moving around, you're having pain, that is not good. That means that it's a major thing now because it's changing who you are. Number 2 is your sleep. If you're not sleeping enough, then you're not going to be healthy. It's going to affect your immune system. It's going to affect your healing ability. It's going to affect so many things inside your body if you're not sleeping adequately. So that's major. A lot of people don't think of that as a big deal, but if you're getting 1, 2, 3 or more hours of sleep lost because you can't get comfortable at night because your hip hurts or it wakes you up in the middle of the night, that's a big deal. You need to make sure you address that. And then if you can't do your daily activities, you're missing out on showering the way you like to shower, taking care of your home, taking care of your meals, taking care of the things you need to do in life, your work, then it is a big deal and you need to make sure that you address that. That is a symptom that I look for in people because some people don't have that symptom and it gives me an idea of the severity. But if it's at this point where it's affecting your sleep, your personality, and your daily activities, work and personal, then it's more severe at this point. And number 8, this is the one that everybody focuses on the most, X-ray changes. If it gets to this point where you feel like you need to go to the doctor, you get the X-ray and they're looking at it and they're obviously going to tell you, yeah, you have arthritic changes inside your hip joint. It's an obvious sign of arthritis. But the big thing that I need you to take away from the X-rays is that even if you have X-ray arthritis, if you have visible arthritis on your x-ray, it doesn't mean that you're doomed forever. We have people in our hip arthritis recovery program. We have people coming into the clinic here to see us that have positive x-ray findings. In other words, their x-ray shows they have arthritis, and they get back to doing everything they want to do just fine. They resolve their hip arthritis, they fix it or they cure it, whatever you want to call it. I call it fixed hip arthritis if they're back to walking as much as they want to, if they're back to exercising, if they're back to being their normal selves, they can take care of all their daily activities, they can work and do the things that they love to do. Then even if your x-ray shows that you have arthritis in your hip, you're good. Who cares what the x-ray shows? But if you're before treating it, if you're finding this video right now and you're like, well, I haven't really begun to treat it properly, then I would count that as a symptom of hip arthritis, but it doesn't need to be one that sticks with you the rest of your life and is defining your hip health. You can get better if you have hip arthritis.